Do your gums bleed when you brush or floss? If you answered yes, chances are you have gum disease. Bleeding gums is never normal. This is your body's way of giving you the red flag. Hi, I'm Melissa, registered dental hygienist and senior Burst ambassador, and you're watching Burst TV. In my part 1 video, Why Your Gum Health Matters, I'll be discussing what gum disease is, causes and risk factors, its systemic leak, and prevention. So what is gum disease? The scientific term of gum disease is called periodontal disease. This is a bacterial infection that attacks the gum and the surrounding tissue of your teeth. The effects of periodontal disease can range from mild to severe. In its early stage, called gingivitis, the gum becomes swollen and red. This is when you're going to notice the bleeding. Most people will get gingivitis at some point in their lives, but the good news is you can prevent it and even reverse it just by simply brushing and flossing and, of course, getting your regular dental checkups and cleanings. Poor dental hygiene is the main cause of periodontal disease. Everyone forms oral bacteria called plaque throughout the day. But every time you skip brushing and flossing, plaque gets left on the tooth and gum tissue. There's actually more than 500 bacterial species found in plaque. But not all bacteria is bad. Much of the good bacteria is helpful in fighting the bad bacteria and keeping a healthy balance. But when there's an abundance of bad bacteria in the mouth, it infects the tissue surrounding the tooth, causing inflammation and swelling, eventually leading to periodontal disease. Now, if the plaque sits on your teeth longer than it should, it starts to harden, forming tartar, or sometimes we call it calculus. Tartar buildup can spread below the gum line, creating pockets around the teeth, which can make it harder to clean. And now, at this point, only a dental professional like myself can actually remove this tartar and stop the periodontal disease process. But when it's left untreated, your body's inflammatory response to the bacteria actually causes more damage around the tooth. This can lead to gum tissue to pull away from the tooth and eventually bone loss can occur. This is called periodontitis. The word perio means around the tooth and itis means inflammation. It's important to know that bone loss is irreversible, and the longer it's left untreated, the worse it gets. Eventually can lead to tooth loss. Gum disease is the most common reason behind tooth loss and is mostly seen in adults. The CDC reports in the US that nearly 50% of adults aged 30 years and older have some form of periodontal disease. Periodontal disease does increase with age. 70% of adults 65 years and older have it. This condition is actually more common in men than women and twice as likely to occur in smokers. Now, evidence shows periodontal disease can predispose you to more than 50 systemic health conditions, with diabetes and heart disease being the most common. People with periodontal disease are 2 to 3 times more likely to have a heart attack and stroke because of inflammation. This inflammation releases toxins that travel into your bloodstream, leading to inflammation and blockage of your arteries. Now, the health of your gums and your overall health can actually be a two-way relationship too. Gum health can cause poor overall health, and poor overall health can lead to unhealthy gum. Diabetes is actually the perfect example. Diabetes increases risk of gum disease, and gum disease can cause blood sugars to rise, making it harder to manage diabetes. Other health conditions linked to periodontal disease include kidney and respiratory disease, osteoporosis, oral, lung, and colorectal cancers, pregnancy complications, obesity, and Alzheimer's. So what are some of the warning signs? Well, we talked about bleeding and tenderness of the gums or swelling. But if you notice bad breath or just a bad taste, it doesn't go away. Pain when you're chewing. If you feel like your teeth are becoming looser or they just don't fit the way they used to when you're biting. If your teeth become sensitive. If you notice maybe your gum tissue starts to pull away from your teeth. Some risk factors that increase your risk for periodontal disease: smoking, diabetes, poor oral hygiene, stress, heredity, crooked teeth, some underlying immunodeficiencies like AIDS, some medications that can cause dry mouth, female changes like pregnancies. The number one way to keep period disease and inflammation at bay is to adhere to consistent and meticulous oral care routines. Brush and floss every day to eliminate plaque buildup and minimize risk of tartar, which forms on your teeth and gums every day. And be sure you do schedule your dental checkup and cleanings at least every 6 months. We'd love to see you. Well, if you thought my part 1 video, Why Your Gum Health Matters, was helpful, please give me a thumbs up. Be sure to catch my second video, Why Your Gum Health Matters, where I will take you into the dental office to show you how we diagnose gum disease, explain the different classifications, and treatment procedures. Don't forget to subscribe to Burst TV if you haven't yet to catch fun and educational videos which post every Thursday. Thanks for watching Burst TV. Take care and be safe.